Let's bring in my good friend, Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center. And Dr. Joe, where do you want to start today?
Hey, Ray. Thanks. You might be thinking with the topic that I chose today that either I have a case of spring fever from the last couple of days being nice, or this is hot stove sports medicine style, or that I'm rushing things a little bit. But I want to talk a little bit about ulnar collateral ligaments in throwers and pitchers. And the reason for that is these things occur now any time of year in young kids. And I've actually had 3 of them since the first of the year, and one this week already. And I'm not sure that everybody in your audience is aware of the fact that there is a new alternative to Tommy John surgery. And I want to kind of explain how we explain that to young throwers or pitchers, let alone other athletes who can tear this ligament. Although with other athletes, it isn't as often that we have to have surgery. But in kids who are serious about pitching, we do start to talk about surgery. And I wanted your audience to be aware of the fact there is an alternative to Tommy John surgery. The alternative is called primary repair. And it's been around since about 2017, 2018, so we don't have huge numbers to say how successful, but so far so good as to how successful it seems to be. And I reading up on some of the things about it last night and last couple days, and also I spoke with our expert in our town in Akron, Ohio, is Dr. Drew Engels, and he helped me talk a little bit about how he selects patients for this. Drew has been one of the team doctors at the University of Akron for about almost 20 years, working with kids and pitchers and people that have elbow injuries. And so this, as you know, is a tear of the ulnar collateral ligament, the triangle ligament on the inside of the elbow for these kids. And the kids who might be candidates to have the partial repair, people are calling it, or the alternative surgery, as people call it, of the primary repair, would be, number one, people who have an acute tear. It's new. A lot of people wait a long time and they try rehab and other things, and the older it gets, the less chance that a primary repair is going to work. So in people where it's brand new, people where it's closer to the bone where the tear is instead of in the mid-substance of the tear, the people that we get MRIs back and they call it a partial tear, and it's not a full-thickness tear, they might be more a candidate for the primary repair or the partial, alternative surgery. And maybe those that aren't looking to play for more than maybe 2 years. You know, it's such a long commitment to have Tommy John surgery that might be the right person for this surgery. And what they do, Ray, is they actually sew the fibers together. And that's why if the fibers are still strong and pretty good, if they're not fully torn, if they're pretty close together, they sew it together, but they put a very rigid piece of tape, a braid. It's called in the literature an internal brace, suture-type brace. They braid it up, tighten it up, and add it to the repair of the ligament. And this has been out there, like I said, since 2017, 2018. All of the surgeons that do it tell me that they prepare as if they would have to do a full repair, a Tommy John, that if they have to go in, find that tendon, put the new tendon in and repair, they're ready for that. Because if they get in there and see that it's real loose, or if they see there's a big gap, they're not going to be able to do this primary repair. So, of course, the question you'd ask as a parent, how long? Everybody knows with Tommy John surgery, 14 months, 16 months, 18 months, over a year, many times for a kid to be ready to return to pitching and with full Tommy John surgery. With this procedure, Ray, it's about 6 months before people are ready to return. Now, the other question, how do they do with velocity? Are they all the way back when they get return? And there just isn't enough in the literature from 2018 to say for sure. We're confident. There's still a lot of people doing it, so there's confidence that it's a pretty good surgery, but not sure that we get all the way back to the stability that we had before, the velocity that we had before. So even the Tommy John surgery has undergone some variations. There's a team doctor for the Mets by the name of Altchek, who does this docking procedure, a little bit of a new wrinkle on the Tommy John surgery, but it's still, Ray, minimum 12, 14, 16 months before people are back from Tommy John surgery. And you'd be surprised when we see late high school pitchers and at the college level how many kids have gone through this surgery. So it is. I wanted people to be aware, because it's such a, when people come in and they call me, like on Sunday night, I got a call from a guy whose son has a tear. Oh my gosh, how devastating! Out for 18 months, 16 months. There is another alternative now called the primary repair, and certain young people, particularly young people who have good tissue and it's not a full thickness tear, they may get by with this primary repair surgery. So it's something that I wanted to make your audience aware of, Ray. And one more thing today is I wanted to, people kind of asking me about the quiz, the Ray quiz. Can I give you the quick quiz today?
You can. I'll do my best, my friend.
You are the best. I ask other people, or people ask me during the week, and they say, how does he get these all the time? There's these old names for athletes back in the 50s and 60s, and a lot of writers still use them. And the young people kind of scratch their head and say, who are they talking about here? And let me give you a few, and I think a few of them a little bit easier. So number one, who are the athletes that play on the gridiron?
Those are football players.
For sure. And who are grapplers?
Those are wrestlers.
For sure. And how about cagers?
Those are basketball players.
Cagers are basketball players. That's the one that trips a lot of people up. But way back when, they played basketball with a cage around the court. Mm-hmm. How about the hardest one? Probably harriers.
Harriers.
Harriers. Harriers. Who are the harriers?
I'll say track and field.
Yeah, they are cross-country runners.
Okay.
So, again, amazing. You get them all right. I can't stump you for anything. But today, really, what I wanted to do was let people know there is an alternative to Tommy John. If we're headed down that road of tearing that ligament in the elbow, ask about whether your athlete may be a candidate for that. And then you'd want to get to a surgeon that's done a lot of them. And, again, Dr. Engels, who helped me with talking me through some of this, what he looks for. He's a very good alternative in our community, Dr. Drew Engels. So that's really the main point I wanted to make today on a hot stove style sports medicine Wednesday.
Yeah, anytime we can at least touch the subject of baseball, I'm a fan of, Joe. So thank you very much.
Yeah.
I'll talk to you next week.
Thanks, Ray. Have a great week.
You too, my friend. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center with us.